Today we are doing PRP for breast lifting. PRP stands for platelet-rich plasma. And we've already drawn our patient's blood, spun it down, and we put it into multiple syringes over on our table here. So this is our first injection of platelet-rich plasma. You ready?
Mm-hmm.
1, 2, 3, la la la. And we're going to inject by the cleavage. Turn your head to the right for me. Yep. And it is a pretty easy procedure. I had numbing cream on her for the past half hour to 45 minutes. I've already wiped that off. And now we're just doing the injections here. You can inject under the nipple if there's nipple insensitivity to help bring back some of the nerves there. But if not, then we usually just travel around the breast and inject 1, 2, 3. This is also platelet-rich plasma. So we draw about 120 cc's or milliliters of blood and then inject about 60 cc's of the serum. So some of it's platelet-rich and some of it's platelet-poor because we spin the platelets twice. So we start with whole blood, spin it once, we get serum, spin it the second time, we really concentrate the platelets into about 20 cc's, and then we have a bunch of leftover serum, which is platelet-poor plasma, which is coming up next right here. And because we have all of this extra platelet-poor plasma, there's still cytokines and growth factors in here. So I always figure if you have the serum, you might as well use it, otherwise it's just gonna go in the garbage. So we don't want that. And oftentimes we'll combine PRP with a few things. One is we can use something called soft wave, which is ultrasound beam technology to help lift the tissue. We can add then scarlet, which helps with the skin itself, with the texture if there's any kind of stretch marks and things like that. Then we would do PRP like we're doing now and finish off with some PDO threads to help with lifting as well. So that would be the ultimate RMD signature PRP breast lift. We'll be doing all of those things together. It can take anywhere from 2 months up to 4 to 6 months to see the final results. I usually recommend repeating yearly or every 18 months just to keep your results going. But you can do PRP basically anywhere in the body. We do it a lot for hair rejuvenation. If you have thinning hair, we do it for sexual wellness in terms of helping with stress incontinence and, again, sexual health. So erectile dysfunction or orgasm help for women. But again, it treats urinary incontinence. And then we can treat the face with facials to help bring back more collagen and elastin. And then we can use it as filler in the cheeks or anywhere you normally do filler, we can do it. We can put PRP too, because it'll stimulate your stem cells to migrate over and become whatever that tissue is that is the target. So this PRP is going to make more adipose tissue, which is what our breasts are to begin with. So I'm going to wipe off the other side and we'll come back in just a sec. Okay, so now we are on the second side. And I'm going to inject for the cleavage. 1, 2, 3, la la la. Here we go. So aftercare is pretty easy. I don't want you using ibuprofen because we want the inflammation and all the inflammatory cells to be called to where the platelets are. So you want to try to avoid any anti-inflammatories for about a week before and after this procedure. And really, you're just going to be sore for a couple days, just basically from the needle pokes. Platelets can be a little spicy, so you may feel full, which is good. 1, 2, 3. But compared to doing breast augmentation, the recoup time of this is 0. So our patient here is going back to work as soon as she's done with this treatment. So, you know, it can be a lunchtime type of treatment, or, you know, I'm going on a break, I'll be back for you in an hour. You know, we can get this done pretty darn quick. which is nice. And then there's no drains. I always recommend people wear 2 bras for the first few days, especially if you're going to work out. If you're just doing PRP, just keep the girls high and tight. It makes them feel better when they're close to your chest. All right, so this is the platelet pore plasma. 1, 2, 3, la la la. There we go. Again, no risks with this. I mean, I guess you could bruise, but there's no risk of breast implant illness or anything like that that could go along with breast implants. You know, I'm not putting anything that you don't have in your body already into you, because these are your own platelets. So it's really safe, a safe procedure. If there is a certain size that you want to get to, or a certain lift that you want that is a must, then you do need to do surgery, because I can't predict how your platelets are going to react with your body. Okay, ready? 1, 2, 3, last one here. But if you just want a little bit more size, you can increase the size by 1 to 2 cup sizes with doing PRP. And if that's what you're looking for, then perfect. Try it. All right. But like I said, if there's a certain size that that is your goal, then, or a certain amount of lift that you want, then you're going to need to do surgery for that. All right, you doing okay?
Mm-hmm.
All right, we're getting there, almost done. And I do think this press is a little bit larger than the other one to start. Do you think so?
Yeah.
Yeah, so I think what we're going to do is we're going to take some of what I've got here and I'm going to put it on the other side. But we won't waste this, believe me. We're going to go put this on the other side. But basically, you've watched an entire PRP breast lift. So easy peasy. If you want to find out if the breast lift is right for you, you can find us online at RejuvenationMD.com.